individual counseling. You probably just heard that we will be recording today's workshop, and so you'll be able to access that on the TMMC website in about a week and a half. But today our program is presented by the South Bay Survivorship Consortium, and this is a collaboration of healthcare providers and not-for-profit community-based organizations who work together to provide quality education for cancer survivors. Today's program focuses on tips to navigate health insurance and reduce out-of-pocket costs. This includes how to compare options, appeal denials of coverage, manage medical bills and healthcare expenses, and to protect your credit. So before we get started, just to mention some Zoom etiquette, all of your microphones are going to be muted during the presentation. So if you have a question during the presentation, we ask that you please use the chat function to type in the question. And at the end, we'll address those questions with our speaker. And also today, instead of a sign-in sheet, we're using essentially your login as your attendance. So if you're listed as a name that's creative or a nickname or a phone number, please let Brittany know, and we're going to put Brittany's email in the chat box so you can email her if you have a little bit of a different login name than your name itself. And you'll also see at the very end that we have an evaluation, and this will be coming up at the end of the presentation. So we do ask you to fill that out before you log off. And all those answers will be confidential. No one's going to be able to see any of your responses. So again, the recording of the program will be available in 2 weeks on the Torrance Memorial webpage, and I'll put that in the chat box as well. And the link to the program video will be emailed to you if you registered and left your email in the registration. Our next programs coming up will be in the October-November timeframe, and it'll be focused on nutrition. And so tonight, though, we have Erin Baer. She's a staff attorney at Triage Cancer. So welcome, Erin, and thank you for being here.
Thanks, Nancy. Thank you so much for having me. Let me get my presentation up. Here we go. So I'm so happy to be with you today. Like Nancy said, my name is Erin Baer, and I am with Triage Cancer. Please note, for those of you who are going to be watching this recording, that it is being recorded in June of 2024. And I mention this because a lot of what we cover quickly becomes out of date. And so I want everybody to know that the best way to stay current about all the information that we cover will be to head over to our website to make sure that you're getting all of the latest information that's current and up to date. So before I kick us off into more of the substantive areas that we're going to talk about today, I did want to share a little bit more about Triage Cancer and what we do. We're a national nonprofit, and we provide free education on legal and practical issues that might impact someone with a cancer diagnosis or their caregivers. We have wonderful materials available on our website that I will be talking about or referencing throughout our time together. So I highly encourage you to check out our website and our many, many resources. And we do have a variety of different resources because everybody learns in a different way. So in addition to some of our guides that you can read, we also have a podcast and animated videos and webinars that you can see. So financial toxicity isn't necessarily a new term, and was coined in 2013 by Duke researchers to refer to a problem that's not new. Essentially, the financial difficulties that can come from a cancer diagnosis. And that's not just the acute financial issues that can arise, but over the long term and kind of the cumulative effect of a cancer diagnosis and someone's overall quality of life over time. Now, there are several things that contribute to financial toxicity, which can make it difficult to address, because there are several things that we want to take a look at. At Triage Cancer, we think that health insurance status is likely the most important of those things to take a look at. And so we're going to be spending a lot of time on it today. But just to acknowledge that it isn't the only thing, there are also different changes to your employment, whether to work, whether to not work, plus whatever existing financial situation that you already have upon a cancer diagnosis, along with all of the changes that are going to continue to happen, after a cancer diagnosis, whether that be a move or a graduation, et cetera. Okay. For some reason, I'm having a little trouble with my slides. There we go. So one of the things that can make navigating health insurance so difficult is it's kind of like learning a new language. And so if you feel a little intimidated, or if you're not exactly sure what the 4 terms up on the slide mean, you're not alone. Only 4% of Americans felt that they could actually define deductible, coinsurance, copay, and out-of-pocket maximum. In addition, about 40% only feel very confident that they could select the right health insurance for them. So we're going to make it a little easier first by knowing and defining these terms, so we feel a little bit more comfortable with the terms as they're used. So the most important ones, first is premium. And that's going to be a fixed dollar amount that you're going to pay each month just to have health insurance, even if you never see the doctor. It's kind of like car insurance. You're going to pay for it even if you never have a car accident. Then there are costs specific to when you do get care, when you do use your health insurance. First one is your deductible, and that's a fixed dollar amount that you're going to pay every year, that you have to pay before your health insurance is going to start to kick in coverage. Then there's your copayment, and that's something that you're going to pay each time you get care, and it's a fixed dollar amount. So for example, perhaps I go to see my general provider, my main doctor, and I have a $25 copayment. Maybe to see a specialist, it's a higher copayment. But it's a fixed dollar amount. And then there's co-insurance or cost share. And that's also something you're going to pay each time that you get care. But unlike a copayment, which is a fixed dollar amount, this is going to be a percentage of the cost of care. So for example, maybe like we have in the example here, a health insurance plan will cover 80% of a service, and you would be responsible for 20%. The last term I want to make sure that we know is the out-of-pocket maximum. And this is so important for everybody to know, because this is the maximum you are going to pay for your healthcare throughout the year. Once you hit that amount, the insurance is going to pick up 100%. So typically your deductible, your co-payments, your co-insurance, all are going to count towards that out-of-pocket maximum. So the only exception there is the premium. So I think it's helpful to look at an example. We're going to start with Dan. And with Dan's plan, he's got a $2,000 deductible, co-insurance of 80/20, and an out-of-pocket maximum of $8,000. So let's say Dan had to go to the hospital. It's the first time he received care this year. And he has a $102,000 hospital bill. So how much with this plan would Dan actually have to pay? The first step is we would consider that $2,000 deductible and subtract that. So of that, we have $100,000 left. It's an 80/20 plan, so he would be responsible for 20%, which is $20,000. So does that mean he has to pay $20,000? Well, remember, our out-of-pocket maximum is $8,000, and Dan has already paid $2,000 towards his deductible. So he would have to pay an additional $6,000 of that $20,000 bill, and then he'd be done with it. The rest of it would be picked up by the insurance. I don't want to suggest that $6,000 or $8,000 isn't a lot of money. It is, At the same time, that out-of-pocket maximum protects you from that full $20,000, and having the insurance in the first place protects you from that $102,000 hospital bill. We also have a video on our website that walks you through this example that can be helpful if you want to rewatch it. Now, as with most things, the devil is in the details. So I do want to point out a few regarding out-of-pocket maximums. So if you have an individual plan, you'll have an individual out-of-pocket maximum. But if you have maybe your whole family is covered under a plan, there might be two different out-of-pocket maximums, one for an individual and one for your family. The nice place about marketplace plans where you purchase health insurance, we'll talk about more, is you know when you get that plan that your deductible, your co-payments, and your co-insurance are all going to count towards your out-of-pocket maximum. But it's a little different for employer plans, or it can be different from plans that you have from work. So maybe your employer plan might not include the deductible towards your out-of-pocket maximum, or maybe it doesn't include your prescription drug coverage. There might even be, if you have like a PPO, there might even be a separate out-of-pocket maximum for in-network services versus out-of-network services. And then that brings us to two more important terms that I want to make sure that we all know, and that is in-network versus out-of-network. So when you purchase health insurance, your health insurance providers have contracted with different providers, hospitals, doctors, to reimburse them for a specific amount for a claim. So when you go in network, you are essentially going to be covered by your insurance for a set amount. When you go out of network to somebody that maybe your insurance company hasn't contracted with, it's a little bit more of a gamble as to how much is going to be covered. Sometimes there is lower coverage for going to see an out-of-network provider, and some insurance companies, like with some HMOs, are not going to cover out-of-network providers at all. And so you might see these terms allowed amount or contracted amount that have been decided for in-network providers. I think it's also important to know a few terms regarding your prescription drug coverage. The first is formulary, and formulary is just a fancy name for a list that your health insurance is going to cover, a list of the drugs that your health insurance is going to cover. It's helpful to know that these are broken down into tiers by your health insurance company, with tier 1 generally being the cheapest. So generally cheaper generic drugs. So for example, that might be a $5 copayment per your prescription. As you work your way up the tiers, you might have maybe more expensive generics or not, or preferred brand name drugs that are cost a little bit more. Tier 3, we get a little bit more expensive, maybe non-preferred brand name drugs. But you can see that once we hit tier 4, and a lot of cancer drugs are under tier 4, it's not a fixed co-payment amount. We're seeing that co-insurance amount. And so we might be responsible for 20% of the cost of a prescription. And I'm sure, as everybody on this call knows, those prescriptions can be incredibly expensive. And so the co-insurance amount can too, which is all the more reason to know what your out-of-pocket maximum is and to see and make sure that your health plan covers your prescription drugs. There are 3 different places that you can get health insurance in the United States. The largest group is through your employer. About half of the United States, half the people in the United States still get their health insurance coverage through an employer. The next largest group are those who get their insurance from the government, and that could be Medicare, that could be Medicaid, that could be through the VA or TRICARE. And then the smallest amount are people who buy private plans. They buy individual health insurance. And we're going to be taking a look at each. So before we do, I think it's helpful to look at an example of the types of situations that we might find ourselves in, or the kind of callers and people we often meet at Triage Cancer. So here we have Ross and Rachel, who are married, And in July, Rachel needs to take some time off to recover for treatment for treatment and recovery of that treatment. Now she's decided to stop working. So her employer gives her paperwork to continue her coverage through COBRA, which we'll talk about in a minute, with a rather high premium of $800 a month. She also has an option potentially to join Ross's health insurance, but that would be also very expensive. Adding her would cost them about 15% of their household income just for health insurance. Oftentimes, like here, Rachel's worried because her surgery is upcoming. And so trying to navigate those differences in health insurance at this time can be particularly stressful. So when we look at what Rachel's options are, there are the ones that are a little bit clearer. Well, we know that she's got COBRA, and we know that she can join Ross's policy. But, how do we weigh some of those options, and maybe what are some other options that might be available that might be less obvious? Well, one thing I'd want to point out for COBRA is that while $800 a month is a lot, if she's already met her out-of-pocket maximum for that plan, it's only June, let's say, and she has half the year remaining. Well, maybe if she's already reached her out-of-pocket maximum, the COBRA plan might actually be pretty affordable considering she'd only be paying that premium. We have Ross's plan that she can join, but let's not also forget about the marketplace. She can purchase a marketplace plan. And as we'll see, there is a cap on the percentage that you would have to pay for your health coverage on the marketplace, which is 8%. So even though we see that 15% of the household would be through the employer, there is an option that's more affordable under the marketplace. We would also want to consider that even though Rachel is 25 and married and does not live with her parents, that's still an option as well under the Affordable Care Act. So that's not one people would particularly think of. Then there are different timing issues that Rachel would want to consider as well. COBRA would be, as long as she paid her premiums, there would be no lapse in coverage. If she were to purchase a plan on the marketplace, it might not start until August. So if she did go that route, she might want to get COBRA coverage for the month in between so that she continues to have coverage. All of these are things that we're going to go into, take a deeper look at. Before we do, I want to let you know that a lot of this, again, is very confusing, and that we have quite a lot of resources on our website specific to health insurance, whether that be reviewing some of the things that we've already talked about, or going into more depth on some of the webinars. So next, we're going to take a look at how to save money, potentially lower costs for each type of health insurance. So if so many people are getting their health insurance through their employer, it begs the question, what happens when they lose that health insurance? As what we just discovered with Rachel, one of those options is COBRA. Some people think that COBRA it's a health insurance plan itself. It's not. COBRA is the law, and it allows you to keep your employer sponsored coverage for 18 months. And COBRA only applies for employers with 20 or more employees, local state governments. Some states like California have their own COBRA law. So that's something to consider as well. And like I said in the last slide, that these can be kind of expensive. Like for Rachel, it was that $800 premium because the employer is no longer going to be paying a portion of that premium. So maybe before, Rachel's employer was paying 80% of her premiums. Now they're not. She's responsible not only for all of the premiums, but potentially another 2% in administrative fees. So again, we want to consider that out-of-pocket maximum because that premium is pretty expensive, but we want to take that into consideration. In addition, I want everybody to know about something called the Health Insurance Premium Payment Program, or HIP. And this is a way to get assistance paying for COBRA. 31 states, including California, have a HIP program. And essentially, if you have access to a COBRA policy and you are eligible for Medicaid, Medicaid might pay that premium for you. Essentially, they would do a cost analysis, and if it's cheaper to just pay your premium under COBRA than to provide all of your health coverage, then you might be eligible for that program. So to find out if there's anybody who's curious about a state other than California, we have lists for all 50 states on our website. On the marketplace, ways to kind of make sure that we're keeping our costs low are to know a few things. We purchase our insurance on the exchange. So that's a federal government website or Covered California in the state, in this state specifically. And when we buy coverage on the marketplace, we have certain protections that we can count on. One of them is that there's an out-of-pocket maximum, and that in 2024, that out-of-pocket maximum can't be more than $9,450 for an individual or $18,900 for a family. In addition, as we'll look, there's different financial help options that can help with your premium and your copays. So, in states that have expanded Medicaid, like California, individuals who make up to 100% will get Medi-Cal assistance with their health insurance. Folks who maybe make a little bit more than the 100% of the federal poverty level, folks who make between 138% and 250% of the federal poverty level can get help with their premiums through premium tax credits. Individuals who make up to even more can get assistance with their cost-sharing subsidies. And actually up to 400% of the federal poverty level can get assistance as well. And people often think that health insurance through the marketplace is expensive. Maybe it was the last time somebody looked, but I want to point out that like 4 in 5 customers are able to find a plan or eligible for a plan that's under $10 a month. So even if you've looked in the past and thought it was pretty expensive, I urge you to take another look, as you might be eligible for, again, both those premium assistance or the cost sharing assistance. Even if you make more than 400% of the federal poverty level, if your health insurance costs are costing you more than 8.5% of your household income, you would also qualify for financial help so that you wouldn't be paying more than that 8.5%. Here's another example where it's helpful to know where state laws might be different, because in California, in California that you get plans for up to 600% of the federal poverty level. So this column would actually be 600% in California. Now, I do want to point out that this additional coverage for those who make over 400% of the federal poverty level across the United States who are currently eligible for financial assistance. Currently, that's scheduled to last through 2025 under the Inflation Reduction Act, and hopefully Congress will extend that then. I also want to point out that for folks who are eligible for financial assistance on the marketplace, that they have their own special enrollment period as to when they can pick up a plan. So typically, when somebody wants to select or change their health insurance, there are only certain times of the year that they can do so unless they qualify for what's called a special enrollment period. Now, individuals who are at or below 150% of the federal poverty level can enroll anytime if they're uninsured. In addition, they can switch to a silver plan if they're not already in one. So they might be in a platinum plan that's super expensive. It's really hard to meet those premiums, so they can switch to a silver plan. Additionally, you can go from a bronze to a silver plan, or even change from one silver plan to another, which is really important to know, because that might be really helpful if you find that maybe your providers, your coverage isn't covering some of the providers that you want to see. The point is that there's a more flexibility for your health insurance choices when you qualify for that financial assistance. Next up, we have Medicare. And Medicare, to be eligible, you have to be a US citizen or legal resident and be 65 years or older, be receiving Social Security disability insurance for 24 months, or have end-stage renal disease or ALS, which is also known as Lou Gehrig's disease. Now, I think Medicare is a little bit easier to understand if I think of that as I have two lanes that I can drive down. I have two options for my Medicare. First, we have to understand that there's original Medicare, and original Medicare is two parts. The first part is Part A, and that's hospital insurance. And that's going to cover things like your hospital stay, kind of inpatient services, hospice, or maybe skilled nursing facilities. Then you have Medicare Part B, which is going to cover your doctor's visits, your tests and labs, as well as some of the things that you might need, like crutches or a wheelchair. All of that would be covered under Medicare Part B. Now, that's original Medicare, Part A and Part B. In 2003, we added Part D for prescription drug coverage. So if somebody wanted that, they would pick out a Part D plan for that coverage. So there's the basic, that you have original Medicare and Part D. Now, Medicare Part B is only going to cover 80% of your covered claims. And so what do you do about that additional 20%? That can be very expensive, as we've seen. Well, you can pick up a Medigap, and a Medigap is a supplemental insurance that you can purchase from a private insurance company that's going to pick up some of those costs that aren't picked up by original Medicare. So that's one lane you can drive down when you get Medicare. The second one is called Medicare Part C. I recognize that this is pretty confusing. Part C, also known as a Medicare Advantage plan, allows you to take Part A and Part B, and most of the time Part D as well. About 9 out of 10 Medicare Advantage plans cover your prescription drug costs, and bundle it into something that is like a managed care network or an HMO. And there are benefits to selecting your Medicare Advantage plan. One of them is that there is an out-of-pocket maximum. In 2024, that's $8,850. There's no out-of-pocket maximum for, under lane number 1, because Medigap is already going to be filling in and covering most of those costs. A lot of times people will ask me what's better, and it really depends on what that person's specific situation is. So some people like their Medicare Advantage plan because it's easier, or maybe because it covers more than original Medicare. Like original Medicare doesn't cover hearing aids or dental, and sometimes Medicare Advantage plans do. On the flip side, Medicare Advantage plans, you have a limited network of providers to see. Whereas with Medigaps, you can see any provider that takes Medicare. So what's the best? It really depends on the situation that somebody's in. We won't go deep into detail about each of the programs, but I want you to know that there are Medicare savings programs available to help pay with Medicare costs, and you can find out more on our website. There's also specific programs to help with Part D expenses. You have the low income subsidy that can help with your deductible and lower co-payments. Generally, to be eligible, you have to have an income no more than 150% of the federal poverty level. But it's great if you do qualify. Your prescriptions for generics are not going to exceed more than $450 a month or $1120 for brand name. There are also state pharmaceutical assistance programs, like in California, that are available to help with costs. I think it can be helpful to understand the way that this breaks down for individuals when they have Part D. First, they're going to have to meet their deductible, and in 2024, no plan can have a deductible that's higher than $545. Then you're going to enter your initial coverage period. And you're going to pay 25% of your prescription drug costs. And the other 75% is either going to be covered by your drug plan or by discounts provided by the drug company. Now, when you hit your out-of-pocket maximum for your drug coverage, then you're going to pay nothing. And the insurance company is going to pay the remainder because you've entered your catastrophic coverage period. Now, this gets a little confusing, and the media hasn't been really great about explaining it. So the out-of-pocket maximum for 2024 for Part D plans is $8,000. But if you take brand name drugs, then the discounts that the drug company provides are actually applied towards your out-of-pocket maximum. So that means that if you have brand name medications, if you're taking only brand name medications, what your out-of-pocket maximum in reality is going to be more like $3,300. Now, this is counterintuitive because we know, generic always is the one to save money, and generic generally costs less than brand names. But in this situation, it's the opposite, where the out-of-pocket maximum, you're going to be paying less with those brand name prescription drugs. Now, this is only for 2024. In 2025, under the Inflation Reduction Act, there'll be a cap at $2,000 for all drugs. And in addition, in 2025, there's going to be a way to, it's called smoothing, a way to spread some of the costs of that $2,000 out over the course of the year so that you're not faced with this one $2,000 big lump payment at the start of the year. Next, I'd like to talk about how to compare plans, and what I show you can be used for comparing all different types of plans: employer plans, marketplace, Medicare, anything. So let's take a look at an example. We have a bronze plan with a $200 premium and an $8,000 out-of-pocket maximum, a silver plan for $275 a month with an out-of-pocket maximum of $6,000, and our platinum plan of $400 a month for its premium and out-of-pocket maximum of $2,000. So the question is, just looking at this, can you tell me which plan is going to save you the most money, assuming you're going to hit that out-of-pocket maximum? And I don't think you could, because there's a special formula in order to figure this out. And I'm going to tell you, this formula is that you would take your monthly premium, multiply it times 12, because that's what you're going to have to pay for the cost for the entire year, add that out-of-pocket maximum. And once you have those two figures, that is the cap, that is the most that you're going to pay for your health insurance for the entire year. So a lot of people are surprised to see that that platinum plan with the $400 monthly premium actually saves them more than the other two plan because of its low out-of-pocket maximum. Again, this is why it's so important to look at the out-of-pocket maximum, because when we're just looking at premiums, we tend to just get sticker shock, see the $400 and move on. But we really want to do the math to see what is actually going to save us the most. When we're choosing, we want to consider cost, but we also want to make sure that, the health insurance that we're considering covers our providers, the facilities that we use, and our prescription drugs. And for more information, we do have this online, as well as a great worksheet to walk you through that formula. In addition, we have one specifically for comparing Medicare Advantage plans or Medicare plans. And if you go to medicare.gov and enter your zip code, you can see where your options are as well. So now we're going to take a look to see how we can lower costs for each plan. The first thing I want to make sure that we know is our right to appeal. if we are denied coverage or receive what they call an adverse benefit determination, essentially your insurance company is saying no. Either they're saying no to a service or no to paying a claim. You don't have to take no for an answer. You have the right to appeal. And there are two types of appeals that I want to make sure everybody knows about. One is an internal appeal and one is an external appeal. An internal appeal is where you go back to your insurance and say, essentially, like, please reconsider. An external appeal is where you go to an independent or outside entity that's neutral, and they take a look to see if the insurance company got it right. And the reason why I want to make sure people know about the external appeal is because up to 60% of the time, these external appeals are resolved in favor of the individual. They'll say that the health insurance plan got it wrong. The problem is that people aren't appealing. Only 0.1% appeal these denials, which is crazy if you think about it. That's so many millions of dollars that could have been, that would have been alleviated from folks if they had known that they could appeal and that they could file an external appeal. That's why appeals are a real big soapbox issue for us. I'm not going to pretend that appeals are straightforward or easy, but we do have a lot of tools on our website to simplify the process and stay organized in the process. Next up, we're going to look at managing medical bills, and maybe sometimes you feel a little bit like this guy sitting on his park bench talking to his friend, that, since he's been told to avoid unnecessary stress by his doctor, he's just not going to open the bill. And while this is certainly an interesting approach, it is certainly not one that we would recommend, but there are some things that you can do. So I think the first thing is to understand all these different communications that you're getting after you receive service. So you're going to get a bunch of communication from your health insurance company. They're going to tell you, we received a claim. They're going to say, hey, we're processing your claim. Then finally, and most importantly, they're going to send you an explanation of benefits that's going to break down how much you're responsible for. And it's really helpful to look at an example to see all the different types of information that you can have on an explanation of benefits. And I always say you can tell it's an explanation of benefits because somewhere on it, it's going to say, this is not a bill. And an explanation of benefits is going to tell you a bit about who the policyholder is and who received coverage. It's going to say when you got that care and who you got it from. And most importantly, it's going to say how much the insurance is going to cover and how much you might be responsible for. A good explanation of benefits will also keep track of how much you've met already towards the deductible or how much you've paid towards your out-of-pocket maximum. And then there's the bill that you receive from your provider. Now, ideally, this would happen in a logical sequence where you get your explanation of benefits and then you get your bill, but it doesn't always happen in that order. Sometimes doctors' offices are going to be faster at sending the bill than the insurance company is at processing the claim. And we suggest that you wait to pay your bill until you receive your explanation of benefits, because sometimes the provider doesn't get it right. And you don't want to be stuck in a situation where you pay more than you have to and then have to go back to the doctor and ask for that money back. That's a hassle. I would suggest, though, that if you are going to wait until you get your explanation of benefits, that you communicate with your provider. You don't want that due date to come and go without talking to them, because you don't want them to think that you're just not going to pay the bill. And so that they put you in collections and it hurts your credit. Instead, I suggest you reach out to your providers and say, hey, I haven't received my explanation of benefits yet. Can we push back the due date until I receive my EOB? And I've never heard of anybody who's had a problem with this approach. Before we move on, I also want to let you know about charity care, hospital charity care. All nonprofit hospitals have to offer some form of financial assistance. And to find out if your local hospital has such a program, you can go to the $4 website. which the website is on the slide here. On our website, to make life a little easier, we also have a worksheet bill tracker, which is one of my favorite resources. This makes staying organized a lot easier. In it, with the medical bill tracker, what I like is that you can enter in what your deductible amount is and what your out-of-pocket amount is at the very top. And then as you enter information about each claim, it's going to automatically deduct how much you have left towards your deductible and how much you have left towards your out-of-pocket maximum. So I love this because all of my information is in one place, all of the doctor's visits or all of the claims, all of the amount that I've paid, the amount paid by the insurance, it's all organized and in one place. It's really important to keep records of all the different communications that you receive from your insurance and your providers. They're certainly going to be very important if you have to appeal, but they're also really helpful for tax deductions. So every April 15th or there around, we need to file for taxes, and a lot of these costs are deductible. If you need assistance with filing your taxes, you don't have to rely on paying an accountant or a tax lawyer. There are less expensive options like using software, and there are also free services available through the IRS, like the Volunteer Income Tax Assistance Program, that can help you fill out and file. I would say that you should keep your records for at least 3 years in case you're audited, but to be on the safe side, I would suggest you keep it for 6 years. Also, if you're having trouble making a payment, or if it's too much, you can try negotiating with your providers. A lot of people don't think of this. You can reach out ideally before the due date or before the unpaid bill is sent into collections. Timing really matters here for your credit. And there are different options. You can ask for more time. You can ask to see if they would accept a lower lump sum. You'd be surprised at how flexible some creditors can be when they know of a major circumstance that you're dealing with, like a cancer diagnosis. And I'd also say this isn't just with doctors and healthcare providers. These work with other creditors too, like credit card companies or student loans, or even your landlord. At Triage Cancer, we also try to think creatively when it comes to saving money for health insurance. So maybe if we save in one particular area in our budget, then it will provide more financial room for another area. And so there's different places you can look for financial assistance on our website. We have it organized on our cancer finances portion of our website. You can find like the local and regional assistance programs that might be available. We have a list of the programs that are available through various cancer organizations. Some are cancer specific, like Zero Prostate Cancer. Others, like Cancer Care and the American Cancer Society, are not type specific. And we also have information about various private programs that you might be eligible for, like the Health Wealth Foundation. I also want people to know that there are special pharmaceutical assistance programs from the manufacturer that can help not just with the co-payments for the prescription drug you're taking, but they can also help with things like appeals or prior authorizations and help you in other different ways. On our website, you can go and look up your prescription to see what kind of assistance might be available to you. So if you put in your prescription name, you would see who that company is and how to contact them for their financial assistance program. Now, we've covered a lot, and I want to acknowledge that this is a lot of work, and this is a lot of work on top of dealing with the full-time job of a cancer diagnosis and all the stress and time and energy that accompanies it. And I really can't emphasize enough how important it is to ask for help. You probably have folks who are reaching out to you asking, what can I do to help? What can I do to help? Well, here are some ideas. First off, there are tools available online that can help you with things like a meal train or setting up a calendar so that you can get help getting your kiddos to school, or maybe scheduling folks who can take you to your different appointments or run errands for you. There are even programs that, like Cleaning for a Reason, that will help with housework and provide that for free. Sometimes folks think, well, you know, my friends and family are far away, so there's nothing they can do. And that's not true, especially since COVID. There are so many things that can be done remotely, like creating meal planners or creating a grocery list for somebody, or, you know, having that delivered from out of state, even if you're out of state, are all things you can do. In addition, I would suggest that when it comes to looking at your health insurance and looking at your bills, this is a great place to ask for help as well. One idea might just be asking someone to open your mail for you. I mean, that in and of itself can take a lot of time and energy. Maybe you can ask that somebody match your bill to your explanation of benefits. Maybe you have somebody help with your appeals or who takes notes when you're on the phone with your health insurance company. The idea is, I really want to acknowledge how overwhelming all of this can be and how important it is to ask for help and all the different ways that you can ask for help. Before we turn to questions, as promised, I wanted to let you know about our monthly webinar series. Our next one up is on caregiving on June 27th. And if you don't see it live, don't worry, we put the recording on our website. We also offer a free Triage Cancer conference twice a year. We just had one this past month. Our next one is coming up in October, and it's 2 days, it's free, and we provide a lot of information about various topics similar to the ones that we talked about today, but a lot more, as you can see on the slide as well. Finally, I want to make sure that you all know about our legal and financial navigation program. This is where you can reach out to Triage Cancer and fill out a form and meet one-on-one or discuss one-on-one your situation with one of our staff attorneys at Triage Cancer, including myself. Maybe you've gone to the website and you kind of have a sense now of your answer, but you're not really sure specifically how it applies to you. Maybe kind of like when we looked at the example of the Gellers, what Rachel Geller would do. Then you feel free to reach out to us. It's free, and we can talk about your options, and you can know that you're getting accurate information. So I would highly encourage you to do that. And if we don't get to your question, then I would like you to know that please do contact our legal and financial navigation network for additional questions. And from here, let's take some questions.
Yes, thanks so much, Erin. So does anybody have any questions? It looks like Linda has her hand up. So go ahead, you can unmute yourself and ask your question.
Thank you. Erin, you said you wanted more detail.
Oh, if it's regarding your specific, oh, yes, I did.
All I need is, how do I communicate with them in writing? Is there an email for the billing department at TMMC? Because the person whose name and number was given to me as manager, I left a message. I left messages twice. I'm not getting a call back.
Sure.
I'm happy to chime in, Gina. This is Brittany from Torrance Memorial. I'm happy to be a contact if you need a liaison for the billing department.
I'm sorry, I couldn't understand all of that, Brittany.
Oh, hi, Linda. I hear you're a Torrance Memorial patient.
Yes.
Yeah, I'll drop my email and phone. You could call me. I'm a social worker in oncology at Torrance Memorial, and we could kind of talk further about the specifics. And I could try and get you in touch with someone.
Thank you. All I need is someone in authority who will actually connect. Thank you.
No worries. Feel free to reach out to me directly.
Is your email or phone number here in?
I'm going to drop it there right now. Again, this is Brittany.
Thank you, Brittany.
Welcome.
Thanks for that, Linda. I also see and Brittany, thanks for solving that as well. But I see three questions that someone's asking here. The first one is, according to SB 600, insurance companies must cover fertility preservation if a treatment will impact one's fertility, like chemo. Do you have experience with this? I have been paying my copays for visits related to fertility preservation, but I'm wondering if the insurance company should be covering 100%.
That is such a great question. And we have on our website both a quick guide and other information specific to what should be covered by your health insurance company for that type of fertility assistance. I can't speak to the specifics of that plan, but you're more than welcome to, if you still have questions after you go and look at the resources that we have, of contacting our legal and financial navigation line to talk about more about the specifics about your situation.
Okay, great. And I see Jeremy's hand, but there's a couple more questions here. One is saying, have you seen insurance companies cover cold caps due to their benefit in reducing chemo-induced alopecia? And what would be required to submit that request for coverage to insurance?
So that has been an issue about cold caps, about whether or not they are covered. I can't speak to all the different legislative efforts that are going on around the country to get that covered. You certainly, again, this might be a better question for the Legal and Financial Navigation Network, if only because I would want to ask you more questions to really thoroughly review your options. I'd be really curious to learn more about what your health insurance is. And potentially one of the things that you could do would be to have your provider submit the claim, and when it's denied, appeal it, because and suggest that it's medically necessary. So that might be an option for you, but to go for more options, I would say contact us. But Nancy, do you have anything you'd like to add?
Just that she did mention that she says, I have LA Care HMO with 0 deductible. And then she has another question attached to that, but that's the insurance she has, LA Care HMO with 0 deductible. And she's asking next, can someone get an HSA if their insurance plan doesn't include one?
For HSAs, if you're insured, this is a little bit more specific too. I do apologize. Oftentimes when somebody has a question, I have about 10 more that I want to ask before I can feel like I'm providing them accurate information that's specific to their situation, because so much can depend. And even knowing, say, the name of that HMO or the name of that plan, I don't know the policy for that plan, and so it would be very specific to that policy. So I might be able to offer more information based on the type of plan, but without knowing a little bit more, it would be a little bit hard to answer that.
Okay, thanks for that. So is your input on that then to contact Triage Cancer directly and connect with someone there?
Yeah, absolutely. And again, that's triagecancer.org/gethelp. And that way we can look specifically at all the different factors that might be coming in to the equation to see what in your specific situation, what might be the best option for you. But this is also, just since I'm going to say, this is also a really good opportunity for legislative advocacy. This, as I said, this is something that we that I think should be covered, and you can learn more about the different advocacy options on our website as well, and how you can participate in that.
Great. Jeremy, thank you for being so patient. You can unmute yourself and ask a question.
I actually have 2 questions, but this is my first question. My mom passed last month at the hospital, and she was there for approximately, I think, 2.5 to 3, about 3 weeks. We haven't got any bills yet. I was kind of curious on when can I expect the bills to come, and I guess what bills will come, and I guess terms of like amounts and everything, I know I can't really ask that, but I guess when should I expect the bills to come? And what, I guess at that point, I heard that I can negotiate or at least figure out what to do after they arrive. So I guess that's my first question.
Jeremy, I wish that I could give you a timeline. I wish that there was a specific time frame that that providers and health insurance companies have to give you this information by. Unfortunately, I've seen it take very long and different amounts of time. I don't want to scare you. Maybe it will be forthcoming and you won't have to wait long, but I don't think that there's necessarily a specific timeline that you can depend on. But what I would suggest in those situations is to reach out to your provider from time to time and see where the insurance company is in processing those claims. That way too, I mean, again, I'm really sorry about your mom. That way too, you can sometimes after someone passes, when and where that information is delivered isn't always accessible to family. And so being able to stay proactive about when those bills are being sent and processed can be helpful, just in case you make sure that there hasn't been a bill that's been missent and you have a potential due date that's come and gone.
Okay, do I have time for another question?
I think so, yeah.
Yeah, I think so.
Okay, so I'll just assume sometime it's very situational, and just I guess the answer is sometime maybe this year possible, and we'll just go with that. Okay, if I would, does triage cancer, say I had like a more specific question about do I need? I had gripes with my mom's doctor and her care. I felt like it was negligent, but obviously, that's going to highly depend. I had further questions, just regarding on how things went down, and I wasn't comfortable with it. Is that something triage cancer? Is there someone there that can, discuss further with this if I, plead my story or, bring in information to see if I can get answers, or is that something that you guys can't do?
That's a great question. I'm glad you asked it, Jeremy. There are certain things we can do, and there are certain limitations to that. So we don't provide representation to individuals, so we can't give you legal advice. That said, we can tell you maybe what different options might exist, and certainly where you might be able to find an attorney, different methods to do so. So we're happy to talk with you about it. We wouldn't be able to say, yes, this doctor was negligent, or no, this doctor wasn't negligent, or we wouldn't be able to represent you, but we would be happy to talk about your situation further and discuss what options you might have.
Okay, that's fine. Thank you.
Of course.
Thank you. So let's see. I don't see any other questions in the chat box right now. Does anybody have a question or want to unmute themselves?
Nancy, I'll just comment for any of the billing related questions if they are related to Torrance Memorial. I dropped in the phone number to our business office. That is for TMMC, so for hospital visits and scans, anything Torrance Memorial Medical Center related. It's not TMPN to be confused with the physician network, so it's not your oncologist. It would be hospital stays, I believe, certain scans and anything within the hospital. So they for the man, I believe it was Jeremy, was asking about hospital bills. If it was Torrance, I'm not. It doesn't matter whether it was or not. Just a general for the crowd. You could call them and they would let you know more about the status of your bill. Also, please keep in mind you can apply for financial assistance through our billing office. So you would be able to have partial or full assistance if you qualify. So please always ask for that application for financial assistance, right? I believe it's called financial hardship. If you think that might be a situation for you, and the number is below.
Thanks, Brittany. And as I mentioned, if you're not sure, if you're gone to a different hospital or facility and you're not sure if there's financial assistance available, you can go to that $4 website that I mentioned. That'll guide you towards not only what kind of program that they have, but in a lot of cases, they can help you navigate it as well and to fill out an application.
Yeah.
Great.
And if anybody had TMMC specific questions, I left my information in the chat. I will give a shout out for sure to Triage Cancer. I have called the hotline, the website that is provided, just to give you guys an overview of exactly what that looks like. You just fill out a little intake survey, a couple questions about what you're calling for, your phone number, any information you're able to provide. You actually schedule a call. So you schedule like Friday at 1. They very promptly give you a call on the phone and answer and ask, just like Erin was saying, such detailed questions that they can't give you an answer, but you almost decide this is the answer because it's so detailed. And they follow up with a very thorough email. So it's not intimidating whatsoever. It's almost like too good to be true kind of a thing, that it's free like support. I highly encourage you to utilize it.
Thanks, Brittany. And just in case somebody doesn't have access to the web, feel free to call us as well, and we can do an intake by phone as well.
Great. Thank you so much for your time tonight, Erin. Before everybody jumps off, though, we do have a survey that we're going to launch here. Please just spend, I don't know, 2 minutes answering the 4 questions. You can use your mouse to scroll down to get to the next questions. I'm hoping it'll be fairly easy for you all. But again, thank you, Erin. We appreciate your time and knowledge.
Thank you so much for having me. I really enjoyed spending some time with you this evening. And yes, if one of your questions was one of the ones where it was a little bit more nuanced, I really encourage you to reach out to our legal and financial navigation program so we can take a more thorough look at your situation and see what potential options you might have. But thank you so much again for having me.
Great, thank you. And then for those on the Zoom, as soon as you've filled out the poll, you can feel free to leave and have a wonderful night. And hopefully we will see you soon. Right. It looks like it is just Brittany, Greg, and I left.
Hello. Thank you, Erin.
Oh gosh, it's my pleasure. I just wanted to stick around, see if there's any feedback or to see if there's any kind of follow-up that might be helpful.
Yeah, well, you got 5 out of 5. 5 people answered. They gave you all 5 for how would you rate your speaker. Did this lecture meet your expectations? 3 out of 5 were a 5 and 2 out of 5 were a 4. I honestly think that's probably because you never really know what you're signing up for, to be honest. So it might be like, oh, maybe I thought it was this and it was this or whatever. So wording. What topic most interests you for future lectures? This is interesting. So they actually 3 out of 5 said integrative, complementary, and alternative medicine. 0 for 2 for nutrition. That's actually interesting because it's usually all nutrition. And then how would you rate this lecture overall? 4 out of 5 said a 5 and 1 out of 5 said 4. That's pretty darn good.
Oh, good. I'm happy to hear that. Well, I always really enjoy doing these. And thank you. I feel really grateful that you invited me and you invited Triage Cancer to participate tonight.
Yeah, and Brittany, I'm thinking when you send out an email, you can probably include the link to our website where Erin is going to be talking on the 25th of June. It's through CSC San Gabriel Valley, but we are joining them in that, so participants can register through our website. So if they want a refresher or they've thought of some new questions, or they want to invite somebody else, because I imagine, Erin, that the content will be fairly similar.
Yes.
Okay, so it's almost like another opportunity to hear all the information.
It is. And I will say that from speaking as a learner as well, it's been really like, as I've learned these things, multiple exposure, I always hear something new. People always, I mean, there's so much material that's covered that it can be really helpful to give it a second, even third or fourth listen.
Yeah, and that's the link, Brittany, I just put in there, but Greg, same thing. If you hear anybody who might have missed the workshop tonight, there's another opportunity to hear and ask questions on the 25th.
Nancy, would you mind sending that link out to our consortium, please, just to make sure?
Absolutely.
Thank you. Oh, thank you for the wonderful help you provide to this vulnerable population.
I'm sorry that broke up, but what was that, Brittany?
Oh, wait, I read in the chat, Greg, who's here right now, said, thank you for the wonderful help you provide this vulnerable population.
Oh, thank you, Greg. I'm so glad you joined us. Thank you.
And Greg is from Harbor UCLA, the county hospital for UCLA. So I almost feel like you guys could be a really good linkage. You seem to really, I mean, I didn't know that COBRA and people that meet the Medi-Cal income limit, like they could kind of help pay for, what was it, the out-of-pocket, the COBRA costs, right? If it,
The premium payments, yeah.
I mean, shoot. So that's great.
Yeah.
Yeah, and most people don't. It's like, it's a well-kept secret that we don't want to stay a secret.
Right, right. Well, I think the main thing I always take away, because it's like a CEU, there's so much to gather, CEU course set. But I think the main thing I wanted to give a plug that it's easy, just call them with more questions because they don't need to memorize everything, but I think it's just knowing who you guys are. So yeah, for sure. Well, thank you again. Really appreciate it.
Thank you. I hope you all have a fantastic evening.
Thanks, Erin. You too.
Bye-bye.